Gastrointestinal diseases, like C. difficile infection, CDI, are a major concern. CDI has become more common, both in hospitals and the community. This video will cover its causes, symptoms, diagnosis, treatment, and prevention. Let's learn more about this complex condition. Clostridium difficile is a common cause of infectious diarrhea in hospitals. It is more likely to affect older people, those who have been hospitalized before, and those who have taken antibiotics. The bacteria can be spread through contaminated surfaces, healthcare workers, and people who carry the bacteria without showing symptoms. Knowing how CDI spreads is important for preventing and treating the infection. Clostridium difficile infection, CDI, occurs when C. difficile bacteria disrupt the gut microbiota. The bacteria produce toxins A and B, causing inflammation and cell damage. A hypervirulent strain, NAP1/by/027, produces more toxins and worsens infections. Understanding CDI helps develop treatments and preventive measures. The clinical presentation of CDI can vary from asymptomatic colonization to severe life-threatening disease. The hallmark symptom is diarrhea, which is often recurrent and associated with abdominal pain, cramping, and fever. Severe cases may lead to pseudomembranous colitis, characterized by the formation of yellowish plaques on the colonic mucosa. Other complications, such as toxic megacolon, intestinal perforation, sepsis, and death, can arise in patients with severe CDI. Recognizing the clinical manifestations of CDI is essential for prompt diagnosis and appropriate management. Timely and accurate diagnosis of CDI is vital for appropriate treatment and preventing spread. Stool analysis is key, utilizing tests like enzyme immunoassays, polymerase chain reaction, and culture-based methods. Nucleic acid amplification tests provide enhanced sensitivity and specificity. Test choice depends on availability, cost, and local epidemiology. Knowing these diagnostic approaches ensures reliable identification of CDI. The treatment of Clostridium difficile infection, CDI, involves using antibiotics like vancomycin and metronidazole. In severe cases or recurrent infections, fecal microbiota transplantation, FMT, or monoclonal antibodies targeting C. difficile toxins may be considered as alternative treatment options. Antibiotics, while crucial for treating various infections, also contribute to the development of CDI. Inappropriate antibiotic use disrupts the normal gut microbiota, leaving patients susceptible to C. difficile overgrowth. Antibiotic stewardship programs aim to optimize antibiotic prescribing practices, promoting judicious use to reduce the incidence of CDI. These initiatives involve implementing guidelines, educating healthcare professionals on antibiotic selection, duration, and de-escalation, and using evidence-based prescribing strategies. Understanding the role of antibiotic stewardship in CDI prevention is crucial for promoting responsible antibiotic use and minimizing the risk of infection. To prevent the spread of Clostridium difficile infection, CDI, healthcare professionals should prioritize hand hygiene, which plays a crucial role in interrupting transmission. Additionally, cleaning and disinfecting contaminated surfaces is essential, and isolation precautions should be implemented for patients with known or suspected CDI. These measures enhance infection control and minimize CDI transmission in healthcare facilities. Recurrent Clostridium difficile infection, CDI, presents challenges in patient management and healthcare systems. Risk factors include prior episodes, age, severity, and ongoing antibiotic use. Prevention strategies entail prolonged antibiotics, fidaxomicin, FMT, antimicrobial stewardship, probiotics, and toxin binders to improve patient outcomes. Antibiotics play a significant role in triggering CDI. The broad-spectrum nature of certain antibiotic classes, such as fluoroquinolones, clindamycin, and cephalosporins, increases the risk of C. difficile overgrowth and subsequent infection. Alteration of the gut microbiota creates a favorable environment for C. difficile colonization, leading to the development of CDI. Understanding the association between antibiotic use and CDI is paramount for optimizing treatment strategies, implementing preventive measures, and promoting responsible antibiotic prescribing practices. Severe CDI necessitates prompt recognition and appropriate management. Factors contributing to disease severity include advanced age, immunosuppression, comorbidities, and hypervirulent C. difficile strains. Severe cases may lead to life-threatening complications, such as toxic megacolon, characterized by colonic dilation and impaired bowel motility, and intestinal perforation, which requires emergent surgical intervention. Understanding the risk factors for severe CDI and recognizing the potential complications facilitates timely intervention and improves patient outcomes. Managing CDI in special populations requires consideration of specific factors unique to each group. Pregnant women with CDI pose challenges due to the limited treatment options available to them. The elderly are at increased risk of severe disease, complications, and recurrence. Immunocompromised patients, such as those undergoing chemotherapy or solid organ transplantation, need tailored management strategies to balance CDI treatment and immunosuppression. Pediatric populations also experience CDI, requiring age-appropriate diagnostic and therapeutic approaches. Addressing the management nuances in special populations ensures optimal care for these vulnerable patients. Ongoing research efforts aim to develop novel treatment modalities to combat CDI. Several antibiotics, such as fidaxomicin and rifaximin, show promise in reducing CDI recurrence rates. Monoclonal antibodies targeting C. difficile toxins provide an innovative approach to neutralize toxin-mediated damage. Additional strategies under investigation include vaccines, phage therapy, and antimicrobial peptides. Staying updated with the latest therapeutic advances equips healthcare professionals with the knowledge needed to offer the best possible care to patients with CDI. Understanding Clostridium difficile infection, including its causes, symptoms, diagnosis, treatment, prevention, and new therapies, is crucial for healthcare professionals to effectively manage patients and prevent the spread of this challenging gastrointestinal disease. Up-to-date knowledge can lead to better outcomes and control of CDI.